was for you to merge an timeshare or something? Well, 15%.
We traded into this one.
Good morning. We're going to start the Scott County Board of Commissioners meeting for May 1st, 2018. Would you all please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, good morning again. May 1st, 2018, we are going to do the Community Health Board meeting first this morning. And you received the minutes from last November 7th, 2017 in your packages. Are there any additions, deletions, or corrections? And if not, is there a motion to approve those meeting minutes?
Mr. Chairman, I'll move to adopt the minutes from the last Community Health Board meeting.
There is a motion. Is there a second?
Second.
And there's a second. Any further discussion? All those in favor say aye.
Aye.
Aye. Opposed? Motion carries. We're going to go to number 3, partnership, aligning existing resources, volunteers, and programs to achieve shared goals. And Lisa, I think, are you up?
I am.
Come on up. Thank you.
Good morning, Commissioner Wolf and Commissioners. Today, we're going to receive several reports from the Scott County Public Health Department. And we will have, you also have in front of you some of the reports that we're going to provide highlights for today during our time here. The first one we'll introduce is the report to the community. This is our second report to the community. And then we'll do an overview of our community health improvement plan, the update that we provide for the county. We are required to do a community health assessment every 5 years, and annually we do an update on the progress of the issues that we have identified. The 3 issues that we have in our community health assessment were chronic disease prevention, identifying at-risk infants and toddlers, and healthcare access, and you'll receive reports from our staff on those. Just as a reminder, we are meeting as a community health board. We're required to do this twice a year to meet our statutory responsibility under 145A. And these duties under state statute are to identify the local public health issues, and we are required to implement activities to address those priorities under the areas, the 6 areas of the public health responsibilities. And we also are required to monitor the health status and identify and solve community health problems. The first report that you have a semi-final version of in front of you, this is our report to the community. It provides information about the public health programs and services that our dedicated public health staff has done. And just want to point out that most of our audience today is our great and dedicated public health staff. Either one, well, most of you are, just either wave. There's only a couple people that aren't, so thank you for coming out today and being recognized for their good work. And this report also helps us meet our national public health accreditation standards, that we are required to let the community know what services that we have provided. We're not going to go over everything today, but I'll review some of the highlights. Just a quick snapshot. This is a year in review. I know this is an incredibly busy slide, and it really reflects the incredibly busy year that we have had over at Public Health. The other report is the CHIP annual report that you have in front of you, and again, it provides updates on all the progress that we made on issues that we identified in our community health assessment. We did add a new target issue this year of healthcare access, which we will have a presentation on today. But so now we have 4 issues that we have been working towards and providing reports to you. On chronic disease prevention will be reviewed by Jamie Bacchus with the work on SHIP. Identifying at-risk infants and toddlers, Mary Kay Stevens, our maternal child health coordinator, will be doing that presentation. Dr. Wilcox will then also be talking about healthcare access and mental health. And you may read your report at your leisures. It's a lengthy report, both of those, and if you have any questions on those, you can certainly give me a call. So I'm going to call on Jamie Bacchus, our SHIP coordinator, to talk about the good work that we've been doing related to chronic disease prevention.
Good morning, Commissioners. I'm Jamie, and I'm here to talk to you a little bit about what we've done in the last year with SHIP and what's coming up. So last year we had our staff participated in over 22 collaboratives, and that includes like worksite wellness collaboratives, Metro Food Access Network, the Metro Area Agency on Aging, public programs like that. So we participated in over 22 of those locally and regionally, and engaged over 41 partner sites to implement policy, systems, and environmental changes with the overall goal to improve healthy eating and active living and reduce exposure to tobacco smoke. Here's another quite busy slide for you. On the outside of these hexagons, you'll see all of the strategy areas that we work in, and in the inside is all of our like reach data that we call it. So these are the populations or the numbers of people who are potentially impacted by the programs that we carry out. So for healthy eating in communities, which includes community-based agriculture, food retail work, there were 36,481 people who were potentially impacted by these activities. And for active living in communities, that includes our partnership with the Three Rivers Park District, also our work in the comprehensive plan, and we also have a new initiative with the Park District with log rolling equipment that will be implementing this summer, and that includes or encompasses 42,827 individuals in Scott County who are potentially impacted by this work. For workplace wellness, this 5,000 employees are all employees of Scott County companies, and we had 10 work sites participate in the Worksite Wellness Collaborative last year, and this year it's growing, so we're up to 14 this year. And that includes Scott County and also the school districts, several school districts. We also have Hy-Vee as a partner and different businesses throughout the county. And then for schools, we're in every school district in Scott County, and we impacted 11,455 students last year. And for health care, we reported a little differently, and this includes 2 activities that we carried out last year, which focuses on engagement with different healthcare systems and hospitals in our area, and primary care as well, and also a social determinants of health screening tool that we use at our mobile clinic to assess the risk outside of what patients are presenting with. So if they need support with food shelves or domestic violence, we ask questions on that. We connect them to resources throughout the community. Some projects that I'm going to highlight focus a lot on our youth engagement. So this was a partnership with CAPS that we did. Last year, we applied, Jamie Lebonsky, who's a community health specialist with public health, and myself applied for and received 2 additional grants outside of SHIP through the Campaign for Tobacco-Free Kids. And in November, we led over 60 students from CAPS in Shakopee and Prior Lake and Lakeville through a Tobacco 101 training, which kind of explains the harmful impacts of tobacco as well as some information on the tobacco industry. And students requested additional training, it says here on tobacco, but also on alcohol. They're very interested in prevention efforts, and we're hearing that. And in March, on March 21st, it was Kick Butts Day, which is a promotion to kind of quit smoking. Students in Belle Plaine and Jordan Middle Schools participated in some activities, and you'll see on the first floor of the Government Center, we've had a big banner hanging up that was from one of the middle schools where students pledged to be part of the first smoke-free generation. And also, I do want to note, yesterday, the Minnesota Department of Health and the Department of Education sent a joint letter to all superintendents throughout Minnesota warning on the dangers of e-cigarettes and some of the support that we can provide as staff. So we are intending to be responsive to that and any requests that come up from the school districts to support this work. Another project we did this year was with CAPS design students, and this was actually led by our partnership, our parks planner through Three Rivers Park District. We pay for half of his staff time to carry out SHIP initiatives, and this is a video they developed to kind of educate people on some of the benefits of the park and show the different programs that are offered and try to get more people involved. So I'm gonna hopefully, hopefully play that video. So we plan to play that at Three Rivers Park District events, but also through waiting rooms at like the CAP agency and different hospitals to try and get people out and about and moving in the parks. And also we heard from some of our community engagement efforts, just some misconceptions about fees and things like that. So we wanted to just promote the parks and get more people out there. And then another project that we did with a digital design student as well was look at our backstretch community garden. So this is our largest community garden that we have in SHIP, and it's located out by the Workforce Center on Canterbury property. And last year we harvested over 500 pounds of produce that was given directly to WIC clients and the CAP agency food shelf. And this year we're planning to do much more than that too. And this illustration on the right side of the screen was developed by one of the CAP students, and he created all of the promotional materials for this year to help us recruit new gardeners and get the word out about that. So for the 2018 season, we are also partnering with some students through that contacted WIC to build compost bins for an environmental stewardship project, because the ones we have right now are plastic, and we want them to be able to sustain some higher winds. We realized that some of the plastic ones were blowing over, and also give a project that gives back to the community. And then we're also partnering with Youth Builds out of Southwest Intermediate District. They're going to design and build elevated beds for improved accessibility, because we had interest from All Saints Senior Living to have some senior gardeners, and we want to be able to make sure that we're offering wheelchair accessible garden beds as well. And we're going to expand the garden beds by at least 10 this year, and hopefully use this space more as a teaching space in the coming years. So partnering with master gardeners, doing food distribution events, having staff there when CAP is doing those food distribution events to make sure that we're walking people through the garden, that they know that it's there and that it's an opportunity, and then doing some additional nutrition education as well. So for this year, what we're looking at doing is strengthening our partnership with Scott County Libraries through the Learning and Outreach Specialist position. So SHIP is paying for 0.5 of that position for this year to focus on child care engagement, because we'd like to pursue the child care strategy going forward. So that this position is really about relationship building, at least in the SHIP scope. And then also leading youth tobacco prevention trainings for high school students. We expect there will be some interest after that letter was sent out from the school districts to provide technical assistance in that way, so we'll continue to do that. And then breastfeeding friendly work expansion. We have a lot of workplaces who are interested in providing wellness rooms and making breastfeeding friendlier workplaces, so we continue to provide technical assistance in that. And then we're also looking constantly to do performance measurement and quality improvement, and right now we're trying to kind of transition that to build the capacity of our partner sites too, so that they can be more comfortable with evaluating their programs that they're doing as well, and building capacity in the community. And then the next project that I'm going to talk about is the Resilient Communities Project, which is a partnership that the county is a part of with the University of Minnesota. So we have two projects that we submitted this year. One is an edible landscape, and I've created or included a graphic here so you can kind of picture it, what a food forest might look like, but it's expanding on the idea of a community garden and kind of a you-pick farm, but at any time. So students will be partnering with students to conduct a feasibility study that will include looking at different parkland, unused county land, city land that could possibly host a food forest. And we're not talking about like a massive forest. It's much more placemaking and some, small shrubs and things like that. I also included a definition here for a food forest because I know it's a kind of out there concept, but it's an agroforestry system based on woodland ecosystems. It incorporates fruit and nut trees, shrubs, herbs, vines, and perennial vegetables, which have yields, obviously, that are directly beneficial to humans. And the idea is that this space, you don't have to rent a plot. People can just go and pick anytime, especially looking at food insecure areas of our county and accessing fresher produce more easily. And the second project that we submitted was an active living policy analysis. So this will be through our partnership with the Parks District as well, and Nathan will be carrying this out. But we want to better understand how communities support active living. So working with any cities and townships who are interested in looking at this and looking at their ordinances and things, any supporting documents that they have that include active living language. So talking about like bike lanes or spaces for people to gather and go out and be active, recreation, and identify any barriers that exist within their policies in suburban and rural communities. There's very much a focus here on that suburban and rural, because a lot of what we read or what's passed down to us is city. So walkability, bikeability, we know that in urban areas, we know best practices, but what are some of the best practices for this suburban and rural community? So that will be a big component of this as well. And that's all I have for SHIP updates today. Are there any questions on anything I've presented? Yes.
Commissioner Beard.
Mr. Chair, just an observation. You know, mixing bicycles with auto traffic has always been an issue with me. But I wanted to tell you, I was coming into town the other day, and there was a serious bicyclist, you know, the guys that wear the tights that we all love to hate, riding on the bike trail, not in the traffic lane. I wanted to stop at the next intersection and just congratulate him for using our $80,000 a mile bike trail instead of riding on the highway. So just, I'm sorry you triggered that. I didn't.
That's fine. Thank you for sharing.
And you don't want to see me in a bike tights. That would
Okay. Any other questions or comments? Okay. Thank you.
All right, thank you. Now I'll hand it off to Mary Kay Stevens.
Good morning, Commissioners.
morning.
As Lisa said, I'm Mary Kay Stevens. I'm the Maternal Child Health Coordinator, and I've been in my role for about 1.5 years here at Scott County, and this is my first formal opportunity to address you specific to the work we're doing in family health. So I appreciate that opportunity. I'm pretty passionate about the work that we do, so my challenge this morning is to be concise and brief, and I hope that this will just be the beginning of a conversation about what we have going on and invite more discussion in the future. I'm going to show you some highlights about the work that we've been doing this year related to our community health improvement plan. So when we talk about family health, what really does that mean? That is a small team of us within public health that are public health nurses and social workers. And if I may, Mr. Chair, I'd like to acknowledge those here in the room this morning. So we have our newest home visitor, actually, Jennifer King, who is joining us, coming from another home visiting program in the metro area. Angie Boyd, who works with our pregnant and parenting teens and others. Terry Furman, who coordinates our follow-along program, also a home visitor in our Metro Alliance for Healthy Families program. Ruth Highland, also fairly new with us, coming from another program. We have a well-seasoned and skilled group here. Brittany Schmidt, who's been with us for a while, also working with the Metro Alliance for Healthy Families program. So we all wear many hats, and I can tell you that I have walked into a team that is just amazing. You won't find a more skilled, compassionate, and dedicated group of people working with your friends, family, and neighbors in these communities. So you have excellent staff working on your behalf. As you can see here, our mission and focus in family health is really specific to helping children have the best start possible, and we do that in many ways. Everything we do in family health, really, and in public health is an upstream approach. There's a prevention parable that's often referenced in public health, illustrating how we can be effective by, instead of rescuing children who have fallen into the river, by working upstream to prevent children, figuring out and preventing children from falling in. Creating conditions for kids to be able to reach their full potential. Some children might still fall in, but there will hopefully be less to rescue and therefore less demand for resources in the long term. There's a quote by Frederick Douglass that says, "It's easier to build strong children than to repair broken men." And so that's what we are all about, is helping everybody get off to a great start. So first I'm going to talk about our family home visiting program. Here we go. Family home visitings are one such upstream strategy. Why do we do home visiting? There's a strong and growing evidence base for home visiting, with many studies showing that it works. It's a two-generation approach. Quality home visiting programs can improve, all the studies have shown, can improve maternal and child health outcomes, so it leads to healthier moms and babies and dads. We also serve dads and grandma and auntie and whoever else, sister, whoever else might be in the home. Safe homes and nurturing relationships, optimal early learning and long-term academic achievement, and family economic self-sufficiency. Early childhood home visiting, what it really does is empower parents and caregivers to meet their family's needs and engage more fully in their children's care and growth. Home visiting programs can produce a substantial return on investment and are shown to impact the needs that are identified in that community health needs assessment, all of those things we know we want to make an improvement on, including the healthy development of infant and toddlers. And we know that multiple studies have shown that every dollar invested in a high-quality home visiting program can save taxpayers $1 to $5. So if you're thinking about what can we do to address these issues, we are working in a model, in a program that is something that we know can make a difference. There's rigorous evidence around that. So that is a good investment. Home visiting has existed in some form for more than 100 years, leading to healthier, safer, and more successful futures for families. Public health nursing has been a part of that for much of that 100 years in various forms. It connects parents with family support and coaching to guide them in the early stages of raising a family. And just to give you a sense of what is happening on visits, and we say home visits, but it's really wherever the family is at. If they want to meet at school, if they're more comfortable meeting at the library, it's really about what is important to them and where they feel comfortable. So home visits might include an assessment of the child and family strengths and needs. We provide information on child developmental stages and progress. We actually do standardized developmental screening tools to make sure they're staying on track. There are structured parent-child activities. We use an evidence-informed curricula that really facilitates that parent's emotional availability and builds their skills and confidence as a parent. Their family goal setting, what's important to them, where do they want to get to, and we help them with barriers to getting to that along the way. And also assistance in addressing crises or resolving problems. And then we also coordinate with other needed community services or emotional support during stressful times. We are all about building their resiliency so that beyond our years of working with them, which can be 3 to 5 years, that they have the skills and the relationships with others who can continue to be a support to them in the long run. And as you can imagine, with the intensity, that kind of intensity of visits, the home visitors really get to know the families and really build that relationship to understand their story and their goals and their priorities and those things. Services are voluntary, provided in the family's home or other location of choice, and focused on the family's needs and interests, as I've said. In Scott County, we offer 2 types of home visiting. We offer shorter term home visiting, which might be 1 to 2 visits when they bring the baby home from the hospital because they have a condition or something like that. Or it can be up to a year or more depending on what the family is interested in and what their needs are. All of the best evidence in home visiting is built into these shorter term programs. It just doesn't have the same intensity or duration as the evidence-based models that have been studied under rigorous methods. So we also offer that, and that is our partnership through the Metro Alliance for Healthy Families. So you might hear us call it MOF, Metro Alliance for Healthy Families. That is our joint powers agreement with 10 other jurisdictions in the metro area, where we have partnered to have the infrastructure to be able to offer this program regionally so that these families who often are highly mobile can move from place to place and continue with the services. So you might hear us call it that. Scott Healthy Families is what we call it locally, or long-term evidence-based home visiting. So I may say those multiple terms, but they really mean the same thing. It's our long-term model. So we are currently offering that to first-time parents, and it is, as I said, an evidence-based long-term intensive Healthy Families America model, which is the national model that we implement. It starts prenatally and is offered up until the child is 3 to 5 years old. And we have been a nationally accredited Healthy Families America site with those 9 other cities and counties since 2015. We have more coming up around accreditation, which I'll share in a moment. So as you can see here in the slide, our small but mighty team here did 1,559 visits in 2017. There were 219 parents and children reached to the program, and we had 30 families who engaged in those long-term intensive visits. There are limits actually on the caseload because of the complexity and duration of the visits, and so they have sort of a cap on what is manageable. This past fall, as part of Scott County Delivers, we worked with Child Protective Services, and we came before you to share what we learned about families in our MOF program and how they were doing in regard to child protection involvement. And we found that 79% of families remained out of child protection services during the program. And I can tell you every day we are able to witness significant change and growth that families are making in tough circumstances. Okay, so when we receive a referral, and our referrals come from hospitals, clinics, people can self-refer, we get referrals from the school district, school nurses, early intervention, just really anyone in the community who has a concern. We first take a look and are wanting to identify those who have the greatest need or are in the highest priority of the families that we want to serve. And so this is just a depiction of the depth of needs that families have. We have the option, you'll see at the top there, to enroll them in our long-term intensive program with professional discretion if we see something in the referral that indicates they might need some additional support. High rates of depression, low income, and single parents, and then a myriad of other substance use. They haven't had prenatal care, may have been homeless, may have had psychiatric hospitalizations, housing is unstable, unemployment, all those things. So just to give you a sense of who is it we are working with. And our short-term program, the risk factors are really the same. It's just for whatever reason it might not be a first-time parent, those kinds of things. It looks very similar as far as who we are serving. So I have a few data highlights for you about the families receiving the long-term intensive visits through MOF. Again, the short-term mirror this, but because our dosage and intensity are most strict in this, it's easier to see sort of where the outcomes lie. So a few highlights of those 30 active families we had in 2017. We had 54% that were enrolled prenatally, 46 were enrolled after they'd had the baby in those first 3 months. We know earlier is better. 63% are young parents between 18 and 23, so these are young people starting off and at a great opportunity for learning and change, and as we know comes with first-time parenthood. 92% have 3 or more of the risks or the criteria for the program, as I showed you in the previous grid. 84% have risks rated over 40. So the criteria that we use as part of the process, which is long and detailed, not for this conversation today, we have a tool that we use in conversation with the family to sort of determine what their needs might be, and any family that has a criteria over 25 would be eligible for the program. Our average family that we're working with has a criteria score of 44. So most of them are over 4, or 84% have risks rated over 40. We screen for multiple things throughout our time with the family, talking with them about domestic violence risk, alcohol use, tobacco use, depression history, mental health history. And just one snippet of that is that we had 18 of 24 who were screened in 2017 answered yes to having had depression at some point, which you also saw illustrated in some of the risk factors grid. 93% of births were full term, 90% stayed in the program for more than 1 to 5 years, which is incredible. Engagement and retention for families with complex lives and a lot going on aren't easy to stay connected or may not have had strong relationships in their life before, so it's sort of a new experience, but we're pleased whenever we're able to connect with them long term. And really excited about recently, not in 2017, but in the last few months, we have actually had 3 graduations from the program, which means they've been with us for at least 3 years, which is pretty incredible. And have had visits ranging from weekly to once a quarter. It sort of varies as the family's needs grow and the children get older, but it's pretty intensive commitment on their part. All right. In the future, we hope to have the opportunity for you to hear from a program participant how it's helped them. Better to hear it from them than from me with all of our numbers and the many things I'd like to share. So, and also would love to extend an invitation if any of you are interested in joining us on a home visit. We have some families who are in a great place to give back to our program by being able to tell their stories. So feel free to contact me if you're interested ever in joining us. All right, moving along to our follow-along program. 2018 is the 20th year for the follow-along program in Scott County. The Scott County Follow-Along Program provides screening and early identification of Scott County kids at risk for developmental delays and social emotional behavioral issues. All of the children in Scott County from birth to age 3 are eligible for the Follow-Along Program, and they voluntarily enroll or opt in for their child. We do outreach to all new births in Scott County. So in 2017, outreach materials went to 1,791 families, kids. The families complete and return questionnaires to Public Health, where the questionnaires are scored. These are standardized, reliable developmental and social emotional screening tools. The families then receive a return letter with age-appropriate activities to promote their development, and if there are any concerns, Public Health nurse, Terry Furman, contacts the family, and next steps are discussed. It's really, sometimes it's ideas and strategies to try to help a child work on their fine motor skills, for example, if that's where the parent has a concern, or of course we have questions about feeding and sleeping and next developmental stages and those kinds of things, so we're able to support them in that. And that's actually a unique role that we play in follow-along program, is having somebody who can be that first contact with a parent who has a concern or where a concern has been identified on the tool to kind of help them try some things early on and then connect them to other resources if needed, or the school district and other evaluations. So the way we talk about it with families is that it's a good way for families to learn about their children, follow their health and development. We had 660 families who participated in 2017, 189 new families enrolled, so they're staying with us and new families are coming on board. It's a fun way for families to get ideas about what to teach and at what age to teach it. We had 645 mailings that were sent with age-appropriate activities, links, and enclosures to support those parents in working on those things. And it's an easy way for families to find out about other services they might want for their child or family. Terry did 139 phone consultations last year with parents with concerns, and there were more than 50 community resources shared with families, including 20 referrals to Help Me Grow, which is our statewide early intervention services. So we were able to help kids get more help if they needed it, and parents wanted to do that. Follow along can also be a safety net. It follows children who don't qualify for those school district or early intervention services to continue to support them on staying on track. We pre-screen for early childhood special ed referrals, avoiding unnecessary referrals for kids who don't quite need that. It's basically a program of ruling kids out. Everybody, those that are doing well, that's great. We want to just be sure that those who aren't have opportunities to work on that. We can also follow them during temporary situations if they have medical or family stressors going on that might impact a child's development. And we also, by sending out screenings in the mail, it's at a lower cost than the formal process or home visit. But we work very closely with those partners to get kids connected to additional services when needed. And one of our favorite parts is to share with you some of the feedback that we've had from parents. And I won't read these, but you can see that families are telling us that they find the information valuable. They've used it with their kids, multiple kids over time. Appreciate having the peace of mind that they're on track, and those kinds of things. Okay. Another program we have is the Early Hearing Detection and Birth Defect Program. When a newborn is identified to have a hearing loss or a birth defect at birth, the Minnesota Department of Health will refer a family to local public health departments to follow up with the family and help them with any barriers to any additional appointments or support, and get them connected to supportive local resources. It's really about making sure those kids don't fall through the cracks and that they have what they need to achieve their optimal potential. Judy Strandy, who's not here today, is one of our home visitors who follows up with those families. Each of the home visitors has their very special skill set that they bring to the work, and she also follows up with families who were informed of that have had a SIDS death to support them with bereavement services and those kind of things. So it's very qualified, and just the kind of person that you would want to give you a call if you were having tough times in life. So, all right. And then in our spare time, we do a lot of collaboration. I've listed here just probably not comprehensive, but quite a list of things we worked on in 2018 and where we've had some really strong partnerships. We see ourselves as only one part of the larger early childhood system, and therefore we work with community partners to improve the health of young families. If you will, we work with our community partners to build bridges across that river that help kids not fall in and be able to cross safely. As shown here, we bring the public health perspective and participate in many other community initiatives. Like I said, we make referrals to Help Me Grow. Each of the staff participates in a Scott Family Net at each of the school districts. We've been a part of bringing up a Circle of Parents support group in partnership with Carver County. That's been going now for 2 years. Angie, one of our home visitors, is part of the professional team at the New Beginnings program for pregnant and parenting teens that serve our Scott County teens. She provides visits to the students there as well as works with the other professionals in supporting them. We attend other collaborative Metro meetings to keep up on what's going on in practice programs, billing, funding, all kinds of things related to our maternal child health programs. I attend those with the other Metro coordinators each month. I've talked about our partnership with Metro Alliance for Healthy Families. Lisa and I have been participating in the Live, Learn, Earn educational prep group and bringing some thoughts and ideas there from the public health perspective. Last year we did some childcare outreach specific to follow along and development, helping that population know about services and keeping an eye on kids as well. Hospitals and clinics are key partners. I mentioned our Scott County Delivers presentation and work that we did with child protection, which is really just beginning. We did a MOFAS event, a Minnesota Organization for Fetal Alcohol Syndrome. We had a small grant from them to promote healthy pregnancy and messages around no safe use of alcohol 0, 4, 9 months in pregnancy. And we had an event in partnership with St. Francis and many others last spring. And we had over 60 residents participate, which we thought was great for kind of a first time of reconvening a format like this. We've also been a part of the Scott County Remobile and some planning for the programming that'll happen there. And we're also talking with the Scott County Jail about how to facilitate referrals between our programs when women are incarcerated, as well as the Shakopee Women's Prison. It's funny, last week Lisa and I were at a meeting and really felt the sense that the community has a value for what we do. This was at a Live, Learn, Earn Ed Prep meeting, and when Lisa asked what was one or two really important things that could be done in the community to have kids be ready for kindergarten, staff from the school district talked about having home visiting programs that work intensively with kids before 3, so that they come even with more readiness when they come to early childhood screening and are getting ready to go to school. So we appreciated that. All right, what's coming in 2018? Just to touch on that, Lisa and I were part of a team that wrote and submitted a RFP to the Minnesota Department of Health for funding allocated through the legislature for evidence-based home visiting. And MOF was awarded $8.5 million. Scott County will receive, as you see here, over $600,000 through December of 2022. And this is just to expand the services that we're already providing. We'll be able to increase the number of families in the community that we can see. And Lisa will be bringing that forward for your approval at an upcoming meeting. So I'd like to just acknowledge and thank Commissioner Brecky, who's been representing Scott County on the governing board for the Metro Alliance for Healthy Families, and we appreciate your support. You've been well abreast of kind of the things we're doing in that collaboration. And then at the charge of the Scott County Community Health, or the Scott County Healthcare Collaborative, we're planning a training and community conversation around adverse childhood experiences this summer. And we'll be bringing forward a community conversation about self-healing communities with other partners, so more to come on that. Through the support of SHIP, we have 3 home visitors who are going to attend lactation training to increase our support to families as part of home visiting when they choose to breastfeed, because we know the benefits to mom and baby. We're eagerly anticipating the conversion of a new to a new documentation system this year, PHDoc, which really has some of the premier potential for home visiting data collection and reporting and interoperability in the state. So we're excited about what we'll be able to tell you in the future about the families we are seeing. And we are also preparing for to renew, actually, our national accreditation in the Healthy Families America program for Metro Alliance. And what that really means just is that we are working to be sure that families get the best in the services. We have 12 best practice standards that we are very detailed, again, not for this conversation, but I just wanted to show you that these are the pieces that we make sure are in place. Being accredited means that we're replicating the model with fidelity, which is how we can assure that we're getting the same outcomes that were found in the studies. So we have a lot of work that we do around that, and we will be getting ready for Healthy Families to come to visit again in the spring, and they'll be going through records and asking staff about how they do things, and do we have our policies and procedures and orders, and are we really implementing Healthy Families in the way that we know make a difference. And we are also have been talking, we have a draft pilot protocol about how we are going to increase that referral flow with the jails. This is not a new piece, but we continue to want to reach more women early. So our outreach efforts with partners who see women in pregnancy will continue, OB providers, WIC, anyone else in the community, so that we can really build that relationship and help them get ready for baby before baby comes, and help them along that journey long term. So that was a lot of information. I appreciate your attention. Are there any questions I can answer?
Commissioner Becky.
Thank you, Mr. Chair. I did, before Mary Kay even mentioned it, I wanted to publicly recognize Lisa and Mary Kay for their work on that grant through the Minnesota Alliance for Healthy Families. They were part of a small team that brought in that $8.5 million for not only Scott County, the other metro counties, also I think Isanti and Chisago are part of that, as well as the cities of Minneapolis and Bloomington. So $8.5 million seems like a lot, and you look at our number there, but it's all based on population. And Mary Kay and Lisa's work was just crucial to that grant. If you remember me talking about this about a year ago, I talked about how those programs were funded by the United Way, and we had big cuts on those United Way programs. So if they wouldn't have been successful, it wouldn't have meant an expansion. That was like what we're going to see. It would have been a cut to these programs, or us having to choose to use more levy dollars to keep the same programs in place. So publicly want to thank you for your work on behalf of the whole region, and I know that you're part of the reason we got that grant.
Thank you.
Thank you. Commissioner Beer.
That was a lot of information. Appreciate that. It was a lot. And that quote, I don't know who it was, but I agree that it's cheaper to build a strong child than it is to repair a broken man. And there's a lot of broken men wandering around, dazed and confused times 4. There's another old saying that says, if you raise a child in the way they should go, when they're old, they will not depart from it. So both of those sort of have the same idea in my mind of, if you're with these kids for some period of time, do we have any data points long-term that all of this is leading to lifelong transformation? There was that one, I don't know what slide it was, like 79% of the folks do not enter into, I think it was protective services maybe, while in the program. And it's less about the dollars and more about, is meaningful life transformation happening? Do we have data points to support that? So that's maybe a question for another day, but that's what's swirling in my mind is all of this, that's a lot. I mean, this is super emotional, touchy, life stuff, but is it leading to lifelong transformation, or is it just when you're walking alongside them? So I'm certainly not suggesting we walk alongside people for a lifetime, but what we're doing for the time when we're walking alongside, is it leading to transformation? That's my question.
Yeah, it's a very good question. In public health, we have the age-old dilemma of how do you measure things that don't happen? How do we measure prevention? But we do look at, we do have more data about how kids are looking upon exit. About more than 70, just off the top of my head, more than 75% are up to date on their immunizations, have had 50% of their well checks as expected, are on a health plan, and we do patient or client satisfaction surveys in the program, so we get feedback as well about how it has impacted parents annually and upon graduation as well. So we'd be happy to share more about that. And then we also have data about how the models have been shown to make a difference if they're implemented correctly, and a whole body of evidence, like I said. There are also some things coming, that long-term trajectory. I know the state is working on a system that is an early childhood longitudinal data system, and it's just now sort of getting populated to follow kids. I think the dream would be someday we'd be able to say if a child was in home visiting, for example, how did they look at early childhood screening, and how did they look for third grade reading rates, and did they really have less crime and problems down the road, and did parents build skills and do better. Everything that we have for research supports that they do, but I think there's a lot more to be specifically learned. Dr. David Olds, who was the originator of the nurse-family partnership model, has done some longer-term studies and has studies about the impacts of home visiting over the long term. But we have more to do to get more of a look at that locally. So.
Thanks.
Okay,
You're
thank you.
welcome.
Any other questions or comments? Okay,
Thank you.
thank you. And I see Dr. Wilcox is going to
Yes,
come up for a
I'll hand
few
it
minutes.
Thank you.
Morning.
Morning, Commissioners. Once again, it's a pleasure for me to have a chance to come and chat with you today about health issues that we're encountering at the county level. And what I'm going to be focusing on during my piece is talking about access to health care. And we continue to focus on that within the communities within Scott County, and I'm very much a proponent of providing better access to health care within our various communities. We're doing this in a number of ways, and one of the ways that we're providing access to health care for the uninsured or underinsured is to provide immunizations. We actually have a clinic that is available to children and adults. It's the immunization clinic. Our numbers for the year 2017 are listed in our graphic here. We had 129 children who received vaccinations. Of these, 119 were uninsured individuals, and 92% of the children seen actually were uninsured at this point. Now, as we compare statistically what's gone on in 2017, it looks like there's a bit of a drop from what we were doing for our young people in 2016. It's unclear to us why that is, but we'll continue to monitor that as we move ahead with our ongoing work in this arena. As I mentioned to you, we vaccinate not only children but adults. We vaccinated 72 uninsured adults, bringing the total to 201 during the year 2017. And actually, our county public health service is the only provider of free vaccinations for uninsured adults within our county. As you can see, of that group of 201 individuals, many of them got many vaccinations to get them updated appropriately to a level in a manner which hopefully will prevent disease and illnesses and prevent needs for hospitalization and long-term management of their various medical problems. We continue also to provide services through a free clinic venue, a mobile clinic type of venue. For the year 2017, we had 99 uninsured people that we cared for within this setting. Many of these people were seen for acute illnesses. About 55% actually presented with acute illnesses that we dealt with. But as we continued to manage their problems, we found they not only had these acute problems, but they had chronic illnesses also that needed to be properly addressed and at times needed to have appropriate follow-up. And of course, one of the missions that we've had during the time that we've worked within this mobile clinic venue is to provide immediate services for these individuals who could not access health care in any other way, and then find resources that would be made available to them to have long-term follow-up in various clinics within our area. And 33% of the clients within our chronic disease management area were referred to a primary care base for appropriate follow-up, which was a positive thing. Now, if our mobile clinic is not available, but we have encountered problems that need follow-up, we also have available what we call a walk-in clinic venue. This is managed by nursing personnel within our public health department. They provide an alternative to the appointment clinic that we have through our mobile health care services. This clinic is available at the CAP agency from Tuesday and Thursday mornings from 8:30 to 10:30. And it's in that clinic also that folks can receive vaccination updating that's appropriate, along with follow-up care that we may have asked them to follow up on related to issues we've encountered in that mobile clinic venue. As you can see, the focus of our work in this area is prevention. We hope to prevent illnesses that present long-term complications for our patients. And one of the major ways we can do that is to certainly vaccinate them appropriately for various illnesses that can cause problems down the line for them, and also to provide a venue to receive medications appropriate for management of their chronic illnesses and chronic disease processes. The last piece that we really are intent on doing is finding a follow-up venue for them to receive ongoing care to make sure once we get them on the road to appropriate recovery that they have a way to continue to follow up appropriately long-term. We also provide services for the Juvenile Alternative Facility Clinic, the JAF Clinic. Our public health nursing folks actually provide that service, and I provide input on overall management of this piece as well. And as you can see, our nursing services have provided significant clinic initial health care assessments for youth within the first 7 days of admission. You know, we're finding that many of these young people, unfortunately, have not had an opportunity to be seen in a clinic venue before they have gotten into this type of setting. And if they've not been seen in a timely manner, this screen gives them an opportunity for some access to health care that can be followed up as well. As you have been aware, I'm very much interested in this area of having our EMS providers assist us in providing healthcare initiatives within our community outside of what they do as 911 response. We've had an opportunity to utilize this kind of provider, the community paramedic, in a venue within our county, within the jail, within the penal institution here. And we found that we've had this program going on for a little over a year now. It has improved access to health care for clients within that venue. What we've tried to do is achieve a proactive approach in providing medical care as they have entered the jail system. It has enabled our staff to handle increasingly complex cases of folks who have entered that facility with very, very many chronic disease processes. We call them comorbidities. A large number of our clients within that venue have significant comorbidities. Those are listed on the bottom of our graphic here. We're seeing an increased number of individuals within our jail facility who are presenting to us with diabetes not well controlled. We're also seeing older clients entering our system that have a history of chronic obstructive pulmonary disease, issues related to coronary artery disease and congestive heart failure. And on top of this, we have added to this a comorbidity of significant mental health issues. And many of these folks have self-medicated before they've come into our facility and have been abusers of drugs. They have a chemical dependency piece that's a part of this as well. When you add all of these comorbidities together, it presents a significant issue related to proper management and keeping these individuals on track in handling their illnesses through the system and upon discharge from our facility. As a part of this process, I can tell you we have taken certain steps to ensure that this process continues in a timely and efficient manner. And I, as medical director of this program, have executed quarterly CQI meetings with our staff, both our nursing staff and our community paramedics. We've also done this with the staff within the jail itself to be a part of this process. We do case review and issues related to management of these complex medical problems. Our staff also conducts weekly meetings with the jail nursing staff and the CP nursing staff to continue to promote efficiencies in the use of this kind of provider. I have a QA process in place where I review medical protocols and procedures that can be instituted immediately as the patient enters the system without necessarily an okay from me to provide this service. We've developed a medical staff operation model. I've also developed a medical care type of operation manual that our CPs and nursing staff can utilize through a protocol type of coordination of effort. And on top of this, we're striving now to look ahead. And once our individuals within our jail system are discharged, the hope is that we can develop a continuity of care pattern for them that allows them to continue to receive medical care outside of that jail facility that keeps them on track for proper management of their comorbidities and chronic disease processes. Through all of this, we continue to strive to develop efficiencies in the day-to-day jail activities of healthcare of our clients within this facility. And I have here and I won't read this, but Ashley Lindow, who's the head nurse within the facility, has suggested, the benefits of having this kind of provider continuing ongoing care within this facility, and we continue to strive to provide good care to our clients. Now, before I leave you, I want to give you a bit of a heads up about where I feel we in this county are going to be looking to in the next year and the next few years relative to public health related issues. And there are three major issues I think that you will be seeing a lot of both in our county level, at the state level, and national level. We continue to focus on opioid dependencies. This continues to be a major problem for us. We're seeing increasing numbers of individuals who are addicted to opioid drugs, heroin, OxyContin, hydromorphone, products of that type. Fentanyl, cofentanyl, we've talked about this before. Now, chemical dependency is an interesting problem because the type of chemicals that are abused tend to change over time based upon availability and expense. And what we're finding now is many of the folks are moving away from heroin and from opioids back to meth. And what you can see now, Star Tribune had an interesting article on Sunday that addressed this very issue. Methamphetamines now are cheaper to obtain than opioids for many of the folks using these drugs in the street. And meth now is coming on board again. You may recall 10 years ago we focused heavily on this problem because it was being produced locally. Now meth is coming to us in a very potent and significant manner from Mexico. But not only is it coming in from Mexico, it's a pure product and it has significant side effects, but now we're starting to produce it again in our county. And it was just brought to my attention that there was a meth lab that was recently busted in Belle Plaine recently. So I'm suggesting to you that this problem with chemical dependency is not going to go away. It's going to change its character, and we'll need to continue to focus on that. Second area of concern, public health-wise, and I'm going to mention to you, is ongoing problems with mental health and access to mental health-related models of care. Article in the Minneapolis paper today, just reviewed, focused heavily on the mental health issues we're encountering within our public school system. Again, within the young people within our school system. Emphasis on depression and issues related to that. We're going to need to continue to focus heavily on handling that aspect of patient care within our communities as we continue to manage their chronic disease processes in the future. Last area I want to mention to you that we've talked about before, sexually transmitted diseases. We are continuing to see sexually transmitted diseases occurring within our young and adolescent populations. And this is problematic because it not only can lead to acute illness, but it can lead to problems with fertility and long-term chronic management of issues related to pelvic inflammatory disease and various other things. So we're going to need to continue to focus, in my mind's eye, over the next year to 5 years on these three areas in particular. Now, with those thoughts, I'll leave the floor open for questions. Can I answer any questions for you?
Any questions or comments? Are they that, Doctor, are they that available, these opioids? I mean, and they're coming from Mexico? These aren't prescription.
These are not prescription drugs.
This is,
Commissioner, I can tell you, I do mentoring in New Prague with junior students are interested in going into healthcare. And as I get to know them and I interact with them, one of the questions I will ask them is, how easy is it for you to get heroin? Or how easy is it for you to get meth? And these students are not into this, but they can unequivocally tell me, I could get this for you this afternoon.
is there a way we could catch the guy selling it and get them this afternoon and
That's the
them away?
question. That's what we'd have to focus on. But the issue is, we need to continue to work with our young people in providing mechanisms that they can utilize to stay away from this kind of need for chemicals.
Okay, any other, Commissioner Beer?
This always goes through my mind when I hear opioid epidemic. I can't help but wonder, and I'm certainly open to a suggestion on this, would that be more aptly, in your opinion, labeled hopelessness epidemic? That is filled by X, Y, and Z. So my question is, are we focusing on the right? I know that's the scab that we see, but the underlying reason of the why, I know there's a lot of them, but would that be a more appropriate label?
Commissioner, I think that's a great point. Focusing on what's causing this need for these chemicals, I think, is what we need to really look to. And if you reflect on why people start utilizing these kind of products, sometimes it's a mental health issue. Sometimes they're utilizing these drugs to self-medicate for a mental health type of problem like depression or issues of that type. Sometimes they come from a background, a family background, and you alluded to this, and this was brought up, a background where they've had no support. They've had no adult mentoring. They've had minimal parental support. And they end up then gravitating towards this kind of a problem as a result of those initial issues. I would also suggest to you that folks tend to get into this higher level of chemical addiction by entering this process with what we call bridge drugs. Marijuana, alcohol, these kind of drugs, cigarette smoking and nicotine. These sorts of things can lead to a later addiction problem with opioids and with products like stimulants, amphetamine, methamphetamine, cocaine. Any other questions? Great
Okay.
questions.
Any other questions or comments? Okay.
Thank you.
Well, thank you.
Thanks.
Is that, we're done then? Okay, thank you. That concludes our Community Health Board meeting for the May 1st, 2018. Is there a motion to adjourn?
Mr. Chairman, if you're looking for the motion to adjourn, I'll make that.
Okay,
Second.
and there is a second. Thank you. We will adjourn this meeting. We're going to take 5 or so minutes. Let's meet back here at 1:15. They need to change the tape, and some people are going to come in here. So we'll be back at 10:15 for the regular Scott County Board meeting. Thank you. We're in recess.
All right.
this up and running and we're going to start.
All right, I gotta cancel my notes. I actually have to ask some questions of them. All right.
Ratings.
You have time for lunch today?
I think if I'm not meeting with them,
Do I go to lunch today? I'm gonna take the commissioner to lunch.
You want to go?
You
I
want-
could maybe go.
I can't today.
You hesitated, so it's.
Right,
not
I was
we on
thinking
today?
about what I have
No
to do.
snow?
Where do you wanna go?
Not Wampatch.
I was on the last two.
How about Dangerfield?
You just didn't make it.
Are they open?
Are you gonna make it today?
What?
Hey, we could walk in the road and get free.
Let's do that.
Could be, I don't think we're gonna get there in time. That's what I'm worried about. If we're gonna get there in time.
We go to Dangersfield, we get lucky, you know.
Okay, is everybody ready?
You know, we still have snow on our cul-de-sac. Irrigation.
Okay, we're going to reconvene the Scott County Board meeting for May 1st, 2018. We've already done the pledge before the Health Board meeting. I saw no amendments to the agenda, and you received the minutes in your packages. Are there any additions, deletions, or corrections?
Mr. Chairman, I'll be happy to move the minutes as presented.
There's a motion. Is there a second?
Second.
And a second. Any discussion? All in favor, say aye. Aye. Opposed? Motion carries. Recognition of interested persons. This is for persons to come speak about items not on the agenda, and 5 minutes per person. The person speaking is asked to approach the microphone, give name and address for the benefit of the viewers and interested persons like the person speaking. Is there anyone who would like to come up? Okay, I see one person up.
May I get the overhead on this, please?
Mr. Meiser, have you got, do you have something new to add today?
I do. So I'd like to actually
Okay.
deal with the word that you just used. Can you pick that up?
Okay, and I'm going to have our attorney, Mr. Horsevar, is going to time this today, so you get 5 minutes.
Okay, so let me know
There we
when
go.
we begin with the 5 minutes. Are we beginning now or just so it starts? So I'm gonna
Now.
begin. Now, okay, so we're dealing with the word fraud, and as you just heard, he said person. And we really want to find out, am I one or have we been tricked? So I got to do this fast. So they feel that I'm deceiving them with the word person. And I want to show you guys that a person is not a man, but you can only appear to be a person. Gary Shelton had this argument with me, or an email thing, when he said, person may extend and be applied to. So we're going to find out if in the definition, when bar attorneys define the word person, does it ever apply to a man or a woman? So here we are. What is a person? You heard they said, come on up here in person. I'm not a person, but I can appear to be a person. But what you appear to be is not what you are. It's only an appearance, like I appear to be Santa Claus, but I'm not. So we know every law statute applies to persons. That we all know. That's what we've all been led to believe. But there are also groups of people that want to get chimpanzees, elephants, dolphins, and rivers to be persons. Now, isn't that crazy? Last time I heard this meeting, I showed you that the lawyers at the high-end UN Commission defined a person is created when a birth certificate is issued. Now you look at those kids there, and I think they already exist, but they're not persons until a birth certificate is issued. I didn't say this. The lawyers at the high-end UN Commission said this. So here we have a birth certificate and we have a death certificate. Well, a birth certificate, we now have learned, creates a person, and a death certificate kills a person. But what happens if the man is still alive and a death certificate has been issued? Well, that's when we get something crazy, like I've shown this board here, Donald D. Miller Jr. He was alive, yet he was dead. A judge, a bar attorney acting as a judge, said, I'm sorry, I can't resurrect you. So I went to Paul Marinac, who's the revisor, and Mike knows what the revisor's office is, to say, hey, what dictionary do you guys use? He goes, we don't use a dictionary, we make up the definitions. So I asked him, what's the definition of a person? And he said, a person is a body politic, corporate partnership, or other unincorporated association. Do I look like a corporation or am I a man? Do I appear to be a man or am I a man? So then I went through and I thought, well, okay, because I want to help Gary out on this. I went to the legislative assistant, a woman named Debbie Haskins, and she defined the word person for all 50 states. Not once did they say a person was a man or a woman. And I brought this for the board to look at. Then I said, well, if the word's not defined by the bar attorney lawyers up in the revisor's office, where else can the word be defined? By judges. So if I look over here, I went to that book, Words and Phrases, and if you watch, here's the word person. And now if the word person here ever once says a man or a woman, it never does, but you watch, and you'll see it turn page after page after page. And this is from court case law from 1658 to present. Not once does it say a person is a man or a woman. So now I got a Scott County document where it says I can challenge my property taxes. But it says over here, you may appear in person. It doesn't say be a person. It doesn't say I am a person, but I may appear in person on this document. Why do I have to appear if I am? I am a man. Why do I have to pretend to be something I'm not? So here it is. Which being created and referred to by the name John Miser on the property tax statement owes the tax? Is it the one that was created by my mom and dad? Or is it the one that was created when a birth certificate was issued? So who owns the property taxes? I'm being told I have to appear in person. That's what Tom Wolf just said. You got to come up here and be a person. I'm not a corporation. They're inducing you to commit fraud. You're asking me to commit fraud and say I'm something, I'm a creation of the state. So here's what I'd like to ask you guys up here, if you'd be willing to help me. This is it, really simple. Right here, this is the end of my presentation. If I or others don't appear in person, or if they don't commit identity fraud, one, do I or does anyone else owe the property taxes on this document? On this document you gave me or them. It applies to all you guys too, and women, men and
Mr.
women.
Miser, your time is up.
And who owes the property, me or the county? And I'd like to ask one last question is, I have a house on Cedar Lake. Would that be, I'm not sure if it's District 1, District 2. Tom, can we get a meeting together?
Is it on the west side or the east side?
By Highway 13. Right
You're
by
on
Highway
the
13.
east side.
Yeah.
Okay,
Is that you?
that's me.
Okay. Can I contact you for a meeting?
Contact me.
Okay, great. And then last thing, Luke, would you be willing to meet me? Because this is a case of fraud. Okay, thank you. Thank you very much. This is a copy of my presentation, and this is Debbie Haskins' work on the definition of person in all 50 states.
Okay, anyone else for recognition of interested persons? Okay. Seeing none, we'll move on to number 5, the consent agenda. These items are deemed non-controversial and normally pass in one motion. 5.1, approve the service agreement renewal with the Prairie Care Medical Group LLC for psychiatric consultation. 5.2, adopt resolution number 2018-074, authorizing the Property and Customer Services Administration and Elections Department to establish ballots boards for responsibility to accept or reject ballots for absentee and uninformed and overseas citizens absentee voting act voters. 5.3, adopt resolution number 2018-075, designating the Scott County Government Center as the location for state primary absentee ballot voting pursuant to Minnesota State Statute 203B-081. 5.4, adopt resolution number 2018-076, designating the Scott County Government Center and the Scott County Law Enforcement Center as the locations for state general absentee ballot voting pursuant to Minnesota Statute 203B-081. 5.5, adopt resolution number 2018-068, awarding a contract to Granite Ledge Electrical Contractors Incorporated for the flashing yellow arrow project located at signalized intersections in Shakopee, Prior Lake, Savage, and Credit River Township. 5.6, adopt resolution number 2018-069, awarding a contract to Pearson Brothers Incorporated for the 2018 County Seal Coat Project. 5.7, adopt resolution number 2018-072, authorizing amendment number 2 to the agreement with WSB and Associates Incorporated for consultant services for the Trunk Highway 169 and Trunk Highway 41 interchange project in Jackson and Louisville Townships. 5.8, adopt resolution number 2018-071, supporting the bus rapid transit and Min-Pass express lanes on U.S. Highway 169. 5.9, adopt resolution number 2018-077, declaring no need for an environmental assessment worksheet on the Sand Creek Near Channel Phase 2 project site. 5.10, approve the appointment of Dan Cronquist of Commissioner District 4 to an at-large position on the All Hazards Committee. 5.11, approve the appointment of Tanya Fitzgerald of Commissioner District 4 to the Human Service Resource Council. 5.12, adopt resolution number 2018-067, authorizing limited use permits numbers 7005-002 and 7005-023 with the State of Minnesota Department of Transportation for constructing, maintaining, and operating a non-motorized recreational trail within MnDOT right-of-way of trunk highways 169 and 41. 5.13, adopt resolution number 2018-070, authorizing entering into cooperative agreements with Jackson, Louisville, and Helena Townships and the Shakopee Mid-Wacaton Sioux community for their participation in the 2018 Silcoat project. 5.14, adopt resolution number 2018-073, authorizing the submittal and acceptance of the Minnesota Trail Assistance Grant Program application for the Scott County Snow Trails Incorporated for the 2018 and 2019 snow season. 5.15, adopt resolution number 2018-078, approving the submittal for the final draft Solid Waste Management Master Plan 2018-2036 to the Minnesota Pollution Control Agency, review and approval. 5.16, approve payroll processing of personnel actions. Those are the 16 items on the agenda. Are there any you would like to have pulled for discussion? Commissioner Beard.
I'd like to pull 5.8 and make a brief comment on 5.5.
Okay, 5.8, you don't want 5.5 pulled?
No, I don't.
Okay, 5.8 will be pulled for a separate discussion. And is there another or any other agenda items you would like pulled?
Mr. Chairman, on 5.5, flashing yellow lights, I don't know who dreamed that up, but I hope they are richly rewarded for one of the most common sense traffic safety initiatives I think I've ever experienced. So thank you that we're moving ahead with more of them.
Okay, good deal. And I actually was looking at this second to last one about the snow trails. I thought, boy, we just got done with that program. Anyhow. So we have the additional 15 items on agenda, less 5.8. Is there a motion to approve those 15 items?
Mr. Chair, I'll move approval.
There's a motion. Is there a second?
Mr. Chair, I'll second the motion.
And there is a second for the 15 items, which is less 5.8. Any more discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. 5.8. Commissioner Beard,
Thank
what
you,
would you
Mr.
like to say?
Mr. Chairman, I'm going to move approval eventually, but there are a couple comments I wanted to make because I was one of the elected officials who oversaw that study. And we're about to approve something that doesn't talk about building new lanes on that road, but basically putting in bus rapid transit eventually, and maybe some min-pass lanes eventually. Now, I want you to know that in my participation, one of the things I raised consistently was, well, how about we make it an honest-to-goodness 6-lane freeway first, and then talk about auxiliary lanes or actually min-pass lanes and some sort of mass transit. But I got to tell you, the pushback from the consultants and from the MnDOT Metro in particular, there's sort of an underlying anti-automobile culture that seems to pervade these discussions. And this concerned me because we paid the largest share of this study, and yet every time we brought up additional lanes, it was shot down as part of, basically the dumbest idea they'd ever heard. Get with the program. This is all about moving a lot of people in government-supplied buses. So I just want you to know that we fought for that. It isn't coming forth from this Met Council or this MnDOT Metro District. What we're encouraging is at least we got them off the light rail discussion and got them on bus rapid transit. And if they're going to do bus rapid transit, our encouragement was do it right, do center point entry and exits for the buses instead of making them cross, well, in this case, 2 lanes of traffic because it's going to be a mini freeway, which is proven to create traffic backups and enhance congestion instead of minimizing congestion. It actually fosters it. We can witness this on 35W every morning when the buses come out of the Nicollet station and fight their way to the center lane to get downtown. The traffic snarl that happens is massive and impressive and unnecessary. What we did get out of the discussion, though, was the creation of something called auxiliary lanes. Now, I want you to know auxiliary lanes are, in my opinion, a traffic engineer's secret method to actually increase capacity and decrease congestion. By carrying the lane across the bridge to Pioneer Trail, for instance, as an additional auxiliary lane instead of considering a general purpose lane, taxpayers and commuters on this side of the river will benefit because it does move the congestion point further north. By carrying an auxiliary lane from Anderson Lakes Parkway southbound all the way to the bridge, to you and me that looks like a general purpose lane. That actually will decrease congestion and increase mobility for people who have to drive their cars and have to drive their delivery trucks to do their lives, to live their lives. Those people seem to be the lost continent in this whole discussion, because about 94% of it we can't use consistent transit, especially bus, rapid transit, or light rail. Our lives are not that structured. We're going to get some auxiliary lanes out of the deal. That's a good thing. We're going to eventually get some min-pass lanes. Now, I know you think, well, that's like a toll road. Well, it is kind of. The good news is if your life absolutely demands that you have to get in the center lane and fly, you can get the transponder and pay the price. There was one other comment here. Oh, yes, one thing that kind of shocked me, those of us that have been around long enough, remember when we built the original Bloomington Ferry Bridge with the Scott County Transportation Coalition? Remember those days? Mm-hmm. When that bridge was built, there's a reason those two bridges are exactly so far apart, because there are already piers and footings in the ground all the way across that bridge, across the river bottom, so that someday we could pop a third bridge right in the middle for something like min-pass or BRT. The consultants had no idea that was there. In fact, I don't know that the new kids at MnDOT Metro know that it's there. And when we brought up building a third bridge, they said, oh, too expensive, we'd have to go through all the environmental stuff. I said, we already did that for you in 1989. The piers and the footings, or the footings, to be technically correct, the footings are already in the ground. Well, that was news to a lot of the people around the table. So it was like knocking your head against the wall, but we were grateful to be part of it, grateful to at least get this much moved ahead. And I just wanted to get that on the table, that you know we were there. This commissioner was pushing for additional capacity for people who actually can't live their lives around a transit schedule. And we were shot down at every turn. But in the end of the day, I think the traffic engineers are going to do the right thing and add some additional capacity here and there where it makes some sense and it doesn't have a huge cost. And it'll have, I think Commissioner Sorrell used to call those low-cost, high-impact congestion relief efforts. We'll get some of those out of this project. With that, I'm ready to move the resolution.
Mr. Chair, I have a couple of
That's just
comments.
more comments.
Commissioner Ulrich.
I was also on the group overseeing the study, and I agree with Commissioner Beard. I just want to make a couple points that are related. It was very clear that probably the only way we'll ever get an additional lane would be if it was a min-pass BRT combined lane. And that's the goal, is to get more capacity on 169. And the one thing, a min-pass BRT lane may not happen in our lifetime. It's a long ways out. What this study did, though, was a very good thing. Every project, maintenance, rebuild project that is going to need to be done on the corridor will now be built to size to one day accommodate an additional lane. So if they have to redo a bridge, they're going to make it so it can have another lane each way underneath that bridge. This study has already borne fruit in the project that shut down 139 for almost a year. Causeway or whatever it is on the 9 Mile Creek area was resized and done with the same principle in mind. So it has the capacity for a future additional lane someday in the future. And this a process of rebuilding to size when needed is a way to reduce the ultimate cost of the project. If you don't do that, and then one day you want to do the whole thing, then it's a massive amount of dollars. But as you rebuild, you kind of prepay some of the future project. So that's probably the best thing in my mind, other than the auxiliary lanes, that we would get. I think that was one of the better things of this study.
And Commissioner Beard, so the footings are under there, but so is there a corresponding space in the roadway after the bridge? There is, okay, good.
Yep, it was designed so
The
that
whole
we could
thing.
add those, and we could either put a bus lane, we could put a light rail was the chatter at the time, or we could put a reversible lane like they do on 394, or something in there for that tollable lane, if you wish. You have the whole length of the bridge. On the north side, on the south side, there's going to be a little work where it crosses over the railroad yard, and where things kind of split apart there, but the space is there for 2 lanes and full shoulders going both ways up there. Thank you, Mr. Chairman, by the way, for Commissioner Ulrich's additional insight. Yes, we got some things out of there, and the bridge through we used to call it the Cranberry Bog south of Hopkins. That is a great example of how, once we give them this guidance, the engineers go forth and size it to what's coming in the future.
Had we not been, this study had not been in place and progressing along, they might not have resized that project. So it's already paying off.
There you go.
Okay.
Mr. Chairman, if you'd like, I'll make a motion to adopt Resolution 2018-071, supporting the bus rapid transit Min-Pass express lanes on US Highway 169.
Okay, there's a motion,
Second.
and there's a second. Any further comments? And the one-
Thank you for letting me make those
Yeah.
comments.
And the one comment I have is I've been on a bus with the Med Council at one point. We get all the way over into the Min Pass, we go all the way over to get off on a off ramp, and the bus actually stopped to wait to get onto that last one, and everybody behind them stops, you know, so I have a tough time with that. Anyhow, with the zigging back and forth, and I see people doing it, slows things down in my opinion, so anyhow, that's my comment. Any further discussion? Okay, all those in favor say aye.
Aye.
Aye. Opposed, motion carries. We're going to move to 6.1, and that is the presentation of the 2018 Spirit of Scott First Quarter Awards.
Good morning, Mr. Chair and Commissioners. My name is Troy Pint, and I'm here to representing the Spirit of Scott Committee. The Spirit of Scott Committee works to promote excellent customer service, conduct customer service recognition events, and build the morale and well-being of the workforce. I'm here today to recognize the employees who received the Spirit of Scott Award for the first quarter of 2018. There were 84 employees nominated for the award this quarter, and 6 were selected based upon our established guidelines. We recognize employees who provide exceptional assistance to citizens and other employees, who consistently perform outside of their job scope to promote team spirit, and who displays innovation and creativity in delivering products and services. I'll now share the names of the recipients. Lori Lambrick, Wes Abramson, Jill Cron with the Attorney's Office were nominated by Perry Mulcrone. The Attorney's Office recently went paperless in Q1 of this year. Lori, Wes, and Jill volunteered for the project and were instrumental in getting this very detailed and complex project off the ground. They approached the project like champions with a can-do attitude that spread throughout the entire Attorney's Office. They helped drive adoption and came up with innovative approaches to hurdles and obstacles encountered along the way. All the while they maintained their own very busy normal day-to-day case workload. The whole time they continue with their very positive attitudes and excellent customer service. I really cannot say enough about how hard these individuals worked for the past 12 plus months on this project. They really are rock stars. Next we have Corey Meyer with Facilities, who was nominated by Pam Selvig. I wanted to thank Corey for going above and beyond to assist several employees following a recent snowfall. It was about 5 p.m. and most of the courthouse had long cleared out of the building. Several die-hard employees stayed until the bitter end, and by that point plows had been by and folks were seriously snowed in. One poor person was out in the blowing and drifting snow with a recycling container trying to shovel out their vehicle. Corey assisted at least 4 people by shoveling around the tires, expertly navigating vehicles, and just making sure they could get out safely. It was cold, late, and conditions horrible, but Corey went out of his way to assist all. Last, we have Tony Mansour and Matt McLeese with GIS, who was nominated by Brad Davis. When County GIS staff Tony Mansour and Matt McLeese learned that the County Emergency Dispatch System, LETG, was going down for 12 hours in early January for a planned maintenance, the two quickly responded. In 1.5 days, they developed a GIS application for dispatchers to view emergency service provider information, along with taxpayer information by site address. The application also had the ability for the dispatchers to log calls and view each other's incident information via the map to give an extra sense of spatial awareness. Both worked long hours to work with the dispatchers to ensure their GIS application had access to the information they needed for their jobs. This quick response meant dispatchers were not without proper address information when fielding calls. Tony and Matt responded quickly to a situation and worked overtime, utilizing their technical and analytical skills to produce a workaround solution to help maintain the County Sheriff Emergency Dispatch Services. I know we have Lori and Wes and Matt and Tony in the audience here, so I'd like to say congratulations to them all.
Go.
Okay, thank you, Mr. Pent. With that, we will move to 7.1 and to adopt resolution number 2018-055 proclaiming May 6th to the 12th, 2018 as Correctional Officers Week in Scott County. And I see we have the sheriff here. Good morning.
Good morning, Mr. Chair, members of the board. Today I have two to present, so I'll start out first with the Correctional Officer Week. The purpose of this agenda item is to adopt resolution 2018-55, proclaiming May 6th to the 12th, 2018 as Correctional Officers Week in Scott County. In 1984, President Ronald Reagan proclaimed National Correctional Officer Week in recognition of the difficult and often dangerous work that our correctional officers do in ensuring the custody, safety, and well-being of inmates in our nation's jails and prisons. This week recognizes the professionalism, dedication, and courage exhibited by correctional professionals in the performance of their duties. The Scott County Sheriff's Office correctional employees play a significant role in the criminal justice system by protecting the public, rehabilitating offenders prior to release, deterring others from offending, and following through with offenders to help ensure successful integration back into the community. These efforts are constantly being challenged by the differing needs of an ever-changing inmate population that varies in age, gender, mental, and physical capabilities. The Scott County Jail operates 24 hours a day, 7 days a week, and 365 days a year. In 2017, the jail booked 5,756 inmates into our facility with an average daily inmate population of 148. Many of the individuals in the jail are violent, experiencing chemical dependencies and/or mental illness. Scott County correctional officers make many personal sacrifices as they carry out the duties to ensure the safety and security of our 24-hour facility while preserving public safety. Please join us this week in thanking all correctional professionals for everything they do to ensure our community remains a safe place to work, live, and play. May I read the proclamation?
Yes, please.
Whereas the Sheriff's Office and the Scott County Board of Commissioners support the proposition that the men and women who perform the difficult task of supervising the county's inmate population deserves this recognition. And whereas the Sheriff's Office and Scott County Board of Commissioners recognize that our correctional officers are professionals equal in status and importance to other public safety professionals in the effective administration of justice. Now therefore be it resolved that we, the Scott County Board of Commissioners, do hereby acknowledge the week of May 6th through the 12th, 2018 as Correctional Officers Week in Scott County in honor of the dedicated professionals who supervise the county's inmate population. And we have some of our correctional officers and jail staff in the audience as well today.
Okay, good. Thank you very much. Commissioner Beck.
Mr. Chair, I'll move to adopt resolution number 2018-055, proclaiming May 6th through 12th, 2018 as Correctional Officers Week in Scott County.
Okay, there's a motion.
Mr. Chairman, I'd be happy to second that motion.
And there is a second. Okay, any more discussion? Thank you for all your work. Okay, all those in favor say aye.
Aye.
Aye, opposed. Motion carries. Okay, and we're going to move to 7.2, adopt resolution number 2018-066, proclaiming May 13th to the 19th as Police Week in Scott County. And I see the sheriff here again.
All right, thank you. The purpose of this agenda item is to adopt resolution 2018-066, proclaiming May 13th to the 19th, 2018 as Police Week in Scott County. In 1962, President John F. Kennedy proclaimed the 15th of May as National Peace Officers Memorial Day, and the calendar week in which that falls as National Police Week. National Police Week pays special recognition to those law enforcement officers who have lost their lives in the line of duty for the safety and protection of others. President Clinton also signed Public Law 103-322, which directs the flag of the United States on all governmental buildings be displayed half-mast on May 15th in recognition of National Peace Officers Memorial Day. There are more than 900,000 sworn law enforcement officers now serving in the United States. About 12% of those are female, and there were 129 law enforcement officers killed in the line of duty in 2017. Of those killed, 44 were shot and killed, and 47 were killed in traffic-related incidents. Among the officers who died in 2017, the average age was 42, the average length of service was 13 years, and the average officer left behind 2 children. The National Law Enforcement Memorial in Washington, D.C. honors federal, state, and local law enforcement officers who have made the ultimate sacrifice for the safety and protection of our nation and its people. A number of commemorative ceremonies are held at the memorial each year, and the site is visited by nearly 250,000 people annually. Currently, there are more than 21,541 names engraved on the memorial in Washington, D.C. The men and women that provide law enforcement in Scott County are dedicated professionals who work every day around the clock to protect and serve the citizens who live, work, and travel through Scott County. This resolution is to show support and appreciation and say thank you to the men and women who serve as deputy sheriffs for Scott County, along with the police officers who serve within the communities of Belle Plaine, Elko New Market, Jordan, New Prague, Parr Lake, Savage, Shakopee, and the Shakopee, Midwauketon, and Sioux community. And I'll read the resolution.
Yes, please.
Whereas there are approximately 900,000 law enforcement officers serving in communities across the United States, including members of the Scott County Sheriff's Office and the members of the police departments of Belle Plaine, Elko New Market, Jordan, New Prague, Parr Lake, Savage, Shakopee. And whereas since the first recorded death in 1791, more than 20,000 law enforcement officers have made the ultimate sacrifice and died in the line of duty. Whereas the names of these dedicated public servants are engraved in the walls of the National Law Enforcement Officers Memorial, which was dedicated in 1991 in Washington, D.C. And whereas May 15th is designated as Peace Officers Memorial Day with Federal Law PL 103-322, directing all flags be flown at half-mast on that date in honor of fallen officers and their families. Now therefore be it resolved that the Board of Commissioners in and for the County of Scott, Minnesota, that are hereby acknowledge the week of May 13th through the 19th, 2018 as Police Week in Scott County, and salute the service of law enforcement officers in our community and the communities across the nation.
Okay, thank you. Is there a motion?
Now, Mr. Chairman, I'll move to adopt Resolution 2018-066, proclaiming May 13th to the 19th, 2018, as Police Week in Scott County.
Second?
Thank you. And there is a second. Any further discussion? Okay. They all do a great job, including yourself. Thank you.
Thank you for
It's
your
a
time.
tough job, I'll tell you. So, thank you.
Thank you very much.
All those in favor say aye.
Aye.
Aye. Opposed? Okay, motion carries. Thank you. We are going to move to 8.1, and that is to review the Scott County Watershed Management Organization program activities completed in 2017 and authorize release of the 2017 annual report and newsletter. Good morning, Mr. Holzer.
Mr. Chair, Commissioners, good morning. I'm Ryan Holzer, and this is Melissa Bachman in the Natural Resources Department. We are here, this item is to authorize the release of the 2017 WMO annual report and newsletter, and any edits that this board then would have before releasing. To start off, we've got an outline. So a couple things we're going to touch on: how much, how well, and is anyone better off? Also, we'll touch on end-of-year financials and an overview for 2017. So first, how much? This goes into different practices that we've done or various projects. So one of those is the capital improvement projects that we've done on Sand Creek and Porter Creek. And actually, the chair, Wolf, and Commissioner Beard actually saw one of these projects at our annual tour last September. However, that picture is not included. The bottom left is stream bank stabilization that we completed on Sand Creek. And then also there was a ravine leading down to the creek that we worked on. On the right hand side, we did 12 riparian buffers on Sand Creek and Raven Stream, and Commissioner Weckman-Brecky was in attendance for one of those days as well. However, unfortunately, the photographer was not there that day, or else I would have chosen a photo of Commissioner Weckman-Brecky to display. However, we do have in the bottom right corner, Paul Nelson, manager of the Natural Resources Department, was also in attendance with a couple other county employees. Type and number of cost share projects. We've got a total of 63 projects that were approved in 2017, highlighted by native grasses with 13 applications, and also cover crops, which is Nice because we are moving towards a perennial cover as sort of an emphasis in both those projects. Would constitute a perennial cover landscape, and it's nice to see that residents in the county are applying for those funds and installing those practices. In the bottom left, you can see a breakdown of the total percentages that go towards the entire program. So the WMO makes up over half of the percent of the overall funds for the program. State comes in at about a third, and then the landowners themselves kick in 7%, and then federal is at 4%. And with that, I will pass it along to Melissa.
Okay, part of our capital improvement projects involves aquatic plant management. Unfortunately, there's many counties in the state that have invasive species in their waters, and we currently manage for curly-leaf pondweed in 4 of our lakes. Cedar Lake is one of the largest lakes that we do manage for. We've started to scale back a little bit on the acreages that we are treating for that, but we are seeing great results, which I'll show you in a little while. The total for 2017 that we spent on that management was just over $94,000. The WMO only kicked in about a third of that, with our partners such as our lake associations, the Cedar Lake Improvement District, and the state kicking in the remainder amount of money. This is just to show you how much our levy is compared to how much we're actually leveraging in grant dollars to run our land and water treatment program and get implementation practices on the ground. So you can see the blue bar is what our levy is, which hasn't really changed much over the years. And those orange bars are what we've leveraged from grant dollars. So we've been very successful thanks to Paul Nelson's great grant writing skills. We've leveraged quite a few dollars in grant money. So our land and water treatment program is our largest program. That's where all of our projects get budgeted through, and our biggest projects in there are our capital improvements, any joint projects we do with other cities or organizations, our technical assistance and cost share program, and then our aquatic plant management program. The SWCD, we also partner with them. We pay for their staff time. They're the ones on the ground working with landowners, getting a lot of those projects put in the ground. So in 2017, we spent $1.5 million on land and water treatment, and then you could see it from the pie graph there, over half of that money was coming from grants.
So moving along, how well, getting into cost effectiveness and budget comparisons. So you'll notice that it's a little startling in 2017. The graph we're looking at is the average cost per pound of phosphorus that is removed through our technical assistance and cost share program. The reason for the spike, we believe, and we'll be tracking this in 2018, is a few things. Outcome for some of these practices is actually for runoff reduction, not targeting phosphorus. And so when we're including those in there, it can skew the numbers a little bit. 2, some very efficient projects in years past were completed based on heavier rain events that we experienced causing more damage. Fortunately, we didn't really have those in 2016 or 17, which would lead to the projects that would be constructed in 2017. And lastly,
Commissioner Beard, did you have a question?
Yeah, I was going to wait for him to get to the end of the sentence, then I was going to ask a question.
Okay.
Last thing, we have a shift in strategy. So the focus is on whole farm planning, where that takes more staff time, which is included in these dollars that we calculate, where we're looking at, instead of just a specific conservation practice fixing maybe one ravine, looking at the entire field, and are there other opportunities to improve drainage, soil reduction or loss. And then also the shift to more runoff reduction practices as well.
Now is a good time to ask the question, Mr. Chair. Ryan, I'm looking at this chart here and trying to understand the bottom, which is really where we're trying to get to with the phosphorus reduction. So like 2013, for instance, about 37,000 pounds removed. Is that just from one project in 1 year, or is that a cumulative total? Does that project, or the projects in 2013 continue to have annual benefit going forward, and then relate that to the 2017 jump in spending? Can you?
Yep, Mr. Chair, Commissioner Beard. So the totals on the bottom are a total phosphorus removed for the life of that practice, and it is a cumulative total. So previous, one of the slides showed we had 63 approved projects. So that would be what the estimate is for all those different practices, the total, and then plus the life or the contract life of that project, which generally is 10 years. So we calculate an annual reduction of phosphorus and then multiply that by the years that the landowner is then contractually bound to leave that in.
Follow-on question, so the ones in 2013, is that already the interpolated number that you've given us there?
Mr. Chair, Commissioner Beard, yes,
Okay,
correct.
thank you, that clarifies this a great deal, thank you.
Okay.
With that, I'll give it back to Melissa.
Okay, here are our end-of-year financials. For 2017, the fiscal year ending December 31st. I know it's kind of small, I apologize for that, but this is our amended budget versus actual 2017 revenue. And what I wanted to point out here was that the actual revenue in 2017 was just over 2.2 million, which was roughly 800,000 less than the amended budget, which is the middle column, which was just over 3 million. This was primarily due to the delay of the Sand Creek Phase 2 project. With the delay, expenses were not incurred or reimbursed because it was through a grant. And also in 2017, we didn't have expenses with our 2016 US EPA 319 grant as expected, nor the associated reimbursements that would have came in through that. Okay, moving on to expenses. Expenses are listed by our program elements on the left-hand side. The middle column is the amended budget, and then the last column is the actual expenses. Again, expenses for the year exceeded our revenue received by about $19,000. And so we used $19,000 from the fund balance for the WMO. The most significant deviation from the budget with respect to expenses was for the land and water treatment program. Expenses for that Sand Creek, well, for the Sand Creek targeted grant, so we have several different grants. Expenses for the Sand Creek targeted grant were significantly below what was anticipated due to 3 different reasons. Number 1, Phase 2 of the Sand Creek near channel stability effort was delayed while issues with the property owners were resolved, so there's some access communication that we need to resolve, or Ryan does actually. And number 2, the Sand Creek riparian vegetation project, sign-ups slowed down for that in 2017. And thirdly, the 319 grant, the cost share efforts were a little bit slower than what we expected. The reason for that is we're trying to do with landowners more whole farm planning. So if staff sees multiple things that could be improved on the property, they try to work with them, and it's a tiered system, so we give them a little bit more cost share if they do more things. So those efforts slowed down a little bit in 2017.
So with all that being said, is anyone or our resources better off? First thing, getting back to the cost share program, this is just highlighting one project that we had. The image in the bottom left is from Google imagery, and you can actually see the project on the ground. Their photos are updated fairly frequently, and so fairly neat to see the clearing to allow for the earthwork of this lined waterway to go in. This stream is actually an intermittent stream just south of the former Belle Plaine Golf Course. And so this intermittent stream leads into that DNR protected stream that runs through the former golf course. You can see on the picture in the top right, there's an incising ravine. And the bottom right is the final kind of product a month after it was constructed, where they did a TRM, stands for turf reinforced matting, in that channel. And it's just a heavier duty plastic material that takes a very, very long time to degrade. With this project, there is 315 tons of sediment and 315 pounds of phosphorus being saved through the life of the contract, once again, so 10 years. And it was 700 linear feet of channel that was stabilized. With that, I'll give it back to Melissa.
Okay, I'm just going to highlight just a couple of water bodies that we saw improvements in 2017. So the first here is Cedar Lake, which is showing the water quality. And we have volunteers on 4 different lakes monitor the water quality for us on Cedar, McMahon, O'Dowd, and Thole each year. You'll notice that that purple line on the graph there is total phosphorus measured. The green line is chlorophyll A, which is basically a measurement of algae in the water. And then the 2 different blue colors, the dark blue is where transparency is kind of cut off. The lighter blue color up above is where it's more clear water. So I just wanted to point out that the purple line you can see has been decreasing over time, so the phosphorus concentration is going down in Cedar Lake with the efforts that we've put in carp management and in curly leaf management. There have been a few landowners around the lake that did some shoreline restorations, which is also helpful, but this is encouraging. We are not seeing a decrease yet, or an improvement, I should say, in clarity. That could be because the lake is so long, there's a long wind fetch, there's a lot of mixing in the lake yet. So hopefully over time, we'll see clarity improve as well. The second is McMahon Lake. And each year we have to follow up with curly leaf treatment by an aquatic plant survey to measure any improvements in plant, native plants or the target plant that we're trying to manage. The 2 circled data information there I wanted to point out is the first is the average native plants that we find per sampling point. So we go to multiple sampling points out on the lake, throw a rake in, pull up the vegetation, and identify what's there at that particular point. As you can see, we are now at 1.1, so we're finding at least 1 native plant per sampling point, as compared to back in 2012, we were only finding 0.5. So native plant occurrence is improving. And then the other data point that we like to look at is the number of submersed native taxa, meaning what is the diversity of native plants that we're finding? How many different types of native plants are we finding in the lake each time we go out and survey? And so that has increased to 7, which is very good. Next is groundwater. We offer the water test kits to the public annually, and Environmental Health Department tracks all this data for us, but we did chart it out. And I just wanted to show that what this is measuring is nitrates, that the last 2 years anyways, we're not finding any exceedances in nitrates in groundwater. We will be, I will be heading up another study to randomly test private wells with willing landowners to test their groundwater for several different things. We're going to look for atrazine, nitrates, chlorides, and arsenic, which was recommended by the state of Minnesota Department of Health. So we'll be doing that this year. And this is just a quick overview of our different programs. So our land and water treatment programs, we have capital improvements, and Ryan already highlighted what those CIPs were for the year. We have our tax program, which is very robust. We have, the SWCD has a long list of people who are constantly wanting assistance through that. We have our aquatic plant management program through land and water treatment. And we also have maintenance. So in 2017, the only thing that we spent some maintenance money on was the Clarks Lake outlet. And then finally, I mentioned this before, that our monitoring program, we go through the Metropolitan Council's CAMP program, which is a citizen-assisted monitoring program. We have volunteers monitor our lakes for us. Inventory and assessment, the only inventory that was started in 2017 was another landowner survey with, that we are repeating from 2011 with the U of M. And then planning, basically all of last year was dedicated to updating the Scott-Juvenile Watershed Management Plan. The only other thing I want to say at this point is normally Paul would do a budget amendment at this point after the end of year financials. We're going to wait to do that until July when we receive the watershed-based funding money from the Board of Water and Soil Resources. So with that, we'll take any questions that you might have. Or
Any other questions or comments? It's always, I think, great to see the before and after pictures, and even going out and, you know, I think we're at by Sand Creek, actually by the golf course in the back, and they did that. And I had seen that when I was a kid, and now you look at it now, it's like you don't even recognize it, so it's very nice. So anyhow, any other questions or comments? Commissioner Beard.
Just comment on your draft on the page that has the commissioners. I think the chair and vice chair have changed since you drafted it.
It's for 2017, right?
It was 10, yeah.
Well, okay, then leave it the same, I suppose.
I don't know. I don't know if that is why.
I just noticed it's the editor and me coming up.
Thank you.
Okay. Any other questions, comments? Okay. Thank you very much. With that, we're going to move on to committee reports and commissioner updates. Commissioner Beard.
Thank you, Mr. Chairman and colleagues. On the 17th, I attended the Shakopee City Council meeting. The big development there that night, or the things that were going on, development is a Freudian choice of a word, I guess, were some developments on the Marystown Road around the interchange where we've debated at length, discussed with the city the extension of County Road 16 and turn back of portions of County Road 15 north of there to the city of Shakopee. City Council did vote for the senior independent living project and for a workforce housing project. I think it's called Common Bond, was in there, and a few other adjustments to their comp plan, amendments to their comp plan, because the Met Council is putting a moratorium on Met comp plan amendments here at the end of May, I believe it is. So they had to hurry some things through. Good stuff. It was good to see the City Council in action and doing some good work. On the 23rd, I had breakfast with representatives from the Transportation Alliance. For years, we were members of the Transportation Alliance. We've dropped out of that, which I was supportive of, I believe, several years ago. We may want to talk about this, and I'll bring it up again in the workshop, whether we want to reconsider at this time rejoining the Transportation Alliance. There's some things that are changing there with leadership and with their focus, and of course the legislature is probably going to post a constitutional amendment question to the voters this fall regarding the sales tax on auto parts and whether we want to dedicate that to the highway purposes. So let's take that up, I think, and bring it up in the workshop afterwards. But I did have that breakfast and we did discuss that. I wanted you to know that. On the 24th, I was at the Capitol and attended a Senate reception for Metro Parks. It was actually put on, I think, by Senator Pappas, supposed to be Representative Lilly, who's carrying our bill. Representative Lilly, however, fell out of a tree and was seriously injured, actually. So he could not be there. But we did, I think, make a good impression on the Senate bonding chair about the need for some Metro Parks investment. The 25th, I attended a crisp, well-run meeting on the Mosquito Control Board. Of course, our own Commissioner Wolf is the chair of that committee. Let's see, and on the 27th, I attended the Saints Gala. They're moving the gala from October to April now. It was out at Mystic Lake. Of course, that's an amazing organization involving St. Francis Hospital and St. Gertrude's and the Benedictines, and there were, I think, the largest crowd they've ever had. I heard 750, I think was the number, was there that evening. With that, Mr. Chair, that's my report.
Okay, thank you.
I should add, there have been several times I've been at the Capitol on business and worn my county hat. One is the turn lane legislation we discussed. We did get another small project regarding sanitary sewer projects at Cedar Lake. I think that's on its way to passage. I think Representative Luna carried that. Representative Albright has carried the turn lane legislation for the DAP that Sand Creek Township's part of, and that's running into some extreme turbulence. So I don't know if that bill's going to make it through this year, but now I conclude my report.
Okay, thank you. Commissioner Brecky.
Thank you, Mr. Chair. April 18th, I spent the morning in St. Paul on a Meth's work group. Meth's, of course, is one of our big human service eligibility program. Thank you for nodding, Pam. That has some issues, but it's had some improvement, and really the meeting was a meeting of county commissioners to make sure that we were able to give our feedback to the governance group, who will be making recommendations about Meth's, but also about periodic data match and the testing, the field testing of that. On April 19th, I attended the Fish Faith Breakfast at Ridges in Jordan. I thought a really great turnout of different faith communities from all over the county. The topic, the speaker talked about how faith communities can be more welcoming to people with disabilities. And then also that day on April 19th, we had the Scott County Library Board of Trustees meeting. Monday, April 23rd was the Minnesota Alliance for Healthy Families meeting in West St. Paul, and we heard from Mary Kay Stevens this morning about the work of that group. Tuesday, April 24th, I attended the Live, Learn, Earn Educational Preparedness Committee. At that meeting, we had representatives from all school districts in the county, from their early childhood and early childhood special ed departments, really talking about the efforts of the county, of businesses, of education to get more kids screened at age 3 and what we can do to work together and make that happen. Wednesday, April 25th was the annual GIS Policy Committee meeting in St. Paul. Heard updates about different regional updates and work to GIS programs, but had a great presentation then about drones, and heard about how Dakota County is really using drones in a lot more of their road projects, observing things like that. So it's a very interesting presentation. Thursday, April 26th, had Fish Board meeting in Prior Lake, and that evening attended the Jordan Commercial Club and gave an update on things going on in the county. Then finally, Friday, April 27th, I had lunch with Prior Lake City Council member Zach Braid. I told him I have nothing to do with Prior Lake. No, it was just good to build relationships. And then that evening, I attended the Saints Foundation Gala. Agree, I thought it was a wonderful event. Agree with Commissioner Beard. Heard about the hospital's new campaign to expand the emergency room services, and the ambulance bays, which is very much needed. And then also that same night attended the Southern Valley Alliance for Battered Women fundraiser. So thankfully it was at the same facility, so I could go back and forth and worked with that group. We had Attorney Hocevar was there, Sheriff Hennon, other people from the county who work with that organization quite a bit. So a fun but tiring evening. End of my report.
Thank you. Commissioner Ulrich.
Yes, on the 18th, I have just 3 items to report because I was out of town, but on the 18th, the Transportation Advisory Board, the 19th, Greater MSP, and the same day, the Suburban Transit Association Board meeting. Also, we did learn at Quarters of Commerce that we were not successful in our applications. I think one of ours came in like 6th with like 620 points. I think 660 was one that was fun to us. We weren't far away.
Okay. Thank you, Commissioner Beer.
On the 18th, had a joint 50 by 30 meeting hosted at the Prior Lake City Hall, and it's always good to get the multiple groups together. And my only tidbit for that particular meeting was to remind that we were talking about old problems and bringing old solutions, and maybe we need to think about some new solutions from some of these old problems. I think it went over better than a lead balloon, but we'll see. We'll see. On the 24th, as Commissioner Beard mentioned, I was also down at the Senate office building for the parks reception, and there was a good showing from different county commissioners from the metro, so hopefully that will bode well. On the 26th, there was the 2 open houses for the 42 and 13 project, that was sort of the culmination of several days of phone calls and emails and conversations. If you've been by that area, it looks a bit different than it did a couple weeks ago, and I'm not talking about the snow. So there was an 11:30, I believe it was, 11 or 11:30 open house. There's probably 40 people there, people that came to hear, and then there was a 5 o'clock, and I think we added extra seats because we thought we were going to be 5 o'clock, and there were probably 15 people. And Jake did a great job, and we were fully represented with the county, with people in the back of the room, so it went over very well as far as the lane closures that are going to be happening. But more of the conversation was with how the property looks or the area looks now, with big mature trees gone, houses gone. Again, wasn't a surprise, but when it actually happens, people are very interested in what the final outcome will look like. So, but the open houses were great. Wish more people were there, but 50, 60 were there, and county did a great job representing the why. That concludes my report.
Okay, thank you. My report on the 17th, the Shakopee, was at the high school for Commissioner Brecky's deal with the kids. My ears rang for 3 days. Those kids are loud.
Thank you for coming.
Yeah. On the 19th, the Boathouse Brewery Brothers had their like a little soft opening. And unfortunately, it ended up being a soft closing. And to open up their new craft beer in Prior Lake. So it was, they had some good beers. There were some that were too bitter for me, but anyhow, there was something for everybody. On the 23rd, the Watershed Management Organization, WMO, met. On the 24th, is a couple commissioners mentioned the Senate with the parks down there. I thought that was a pretty nice meeting there. Also met with Eric Pratt and talked about the wheelage tax that we're getting, lack of a better term or word, ripped off on by maybe 2,000 or 3,000 people that are paying their wheelage tax to other counties. So we're going to hopefully get that thing cured up, because some of those people are actually paying $20 when they should only be paying $10. So, and it's going to another county. On the 25th, mosquito control met. There are some open positions out there, and you remember that. So if you're 18 and you'd want to apply, they're paying, I think, $14 an hour for summer help. So go give them a call. As Commissioner Beer mentioned, the 42 and 13 open house, I thought, Jake Bulk did a great job. We even got an email from one constituent there of Commissioner Beer's saying that was very nice, very, very nice.
Teared up.
So, and then the Vermilion River Joint Powers Organization on the 26th also that afternoon, then Elko New Market that night. Also met with Dan Hall about turn lanes, and he's kind of in charge of that on the Senate side, one of the committees there, and he says it's probably not going to happen in the form it's in, and so there may be a different avenue. He'd like to discuss that further with some of us, and so we're going to attack that maybe at a different angle, probably a different year. And then last night, planning and zoning, there's a little project going up out on 169. And that is, and I want to say one other thing about, I think maybe in that public comment, it's about not paying taxes. And I remember a few years ago, I had somebody at one of my townships say, I shouldn't have to pay taxes. My dad fought in the war and I fought in the war. And I said, well, geez, if that's the case, then everybody whose dad fought in the war knows somebody, then let's put all the property into their name. Now you got to create something different. So if this, person thinks that because he's not a person, doesn't have to pay taxes, then something else will happen. So anyhow, it's just, I'm going to leave it at that. Administrator Shelton.
Mr. Chair, Commissioners, just 2 items to comment on. The May 31st Minnesota Commissioners White House Conference.
Yes.
It appears that most, if not all, of the commissioners will attend. I will have Tracy start working on those details now.
We just got it.
If you need to make sure an RSVP, and do be very careful about entering the information because it has to be absolutely the same as it is on your ID, or you will run into issues when you arrive there. If something changes your plans, make sure that we know. We will put on the next board meeting the authorization for the out-of-state travel. At that same time, we have at least one commissioner who's expressed interest in attending the NACO conference in Nashville in July. That's on, I believe, July the 13th, I think is when it starts. I've encouraged board members to consider going to that in the past. I think you would find it very helpful. If anybody else wishes to attend that, if you could also make sure that we know, we'll put that same authorization when we do it in 2 weeks for that out-of-state travel in July. But that, I think, conference you would find very beneficial. It is truly geared towards the policy-making level of what the counties do.
Okay. Thank you. Recess for attorney.
Not necessary.
Not necessary today. Okay. With that, I would look for a motion to adjourn.
Move.
The motion, is there a second?
Second.
And there's a second. We will be meeting after this in a board workshop to talk about Minnesota Valley Transit Authority update, and the annual operation plan of highway will be delayed. Don't text and drive. All in favor say aye. Aye. Opposed?
No.
Motion carries.